The top stories tonight in Y News. The Philippine government targets to vaccinate the general public in July.
Irregularities in the distribution of financial assistance in Metro Manila and adjacent provinces.
The Department of Education says there is no need for an academic break. Former President Joseph Erap Ejercito Estrada is now recovering from COVID-19 after testing negative for the virus.
President Rodrigo Duterte holds talks with Russian President Vladimir Putin over vaccine commitment.
And MCGI Free Store inspires a barangay in San Juan City. Good evening, Philippines and the world. We are now reporting live from EDSA Cubao in Quezon City. Today is Tuesday, April 13, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am Kat Dumaraos.
First in the news. The government eyes to vaccinate the general public and adult population in July. Meanwhile, the palace says President Rodrigo Duterte will be vaccinated once there is enough vaccine supply. Rosa Licos will tell us why.
The Philippine government says the country will be able to have the steady supply of COVID-19 vaccines in the third quarter of the year. Thus, Vaccine SAR and National Task Force Against COVID-19 Chief Implementer Secretary Carlito Galvez said that the inoculation of the general public may start in July. The government eyes the delivery of 13.5 million doses of COVID-19 vaccines by then.
Coming July, na magkakaroon na tayo ng secured and steady supply, ay maaari na po nating bakunahan ang general public at saka mga adult population starting on July.
In July 2021, the government targets to accomplish 1 to 2 million vaccinations every week. Meanwhile, presidential spokesperson Harry Roque believes that President Rodrigo Duterte will be vaccinated in due time following the statement of the chief executive last night that he is waiving his COVID-19 vaccine slot to let other people get their vaccines first.
Panandali ang sentimiento po ni Presidente yung sinabi niyang kahapon na habang hindi pa sapat po ang mga bakuna, hahayaan na muna niya na mauna ang ating mga kababayan bago siya. So I hope that will change po dahil parating naman po yung mas maraming mga supply lalo na sa mga buwan ng Mayo at ng Hunyo.
Roque also believes that President Duterte's inoculation in public will push through once the country secures enough supply of vaccines for the citizens to boost vaccine confidence. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
A government vaccine expert vouched for the safety of Sinovac vaccines amid the recent statement by a Chinese health official about its vaccines having low protection rates. Janice Edhenta reports why.
Dr. Ronjen Solante, a member of the Philippine Vaccine Expert Panel, stressed that the 50% efficacy rate of Sinovac's COVID-19 vaccine is still significant as the country is still lacking vaccine supplies. Solante says that the Chinese vaccine's efficacy qualifies the World Health Organization's threshold. Over the weekend, the director of the Chinese Center for Disease Control and Prevention, Gao Fu, said that current Chinese vaccines offer low protection against the coronavirus.
Approved siya ng FDA, approved ng Vaccine Expert Panel na yung 50% na efficacy can somehow is still very relevant, especially in our setting na wala tayong bakuna or konti pa yung bakuna and we have this surge, no? Yung issue ng efficacy, hindi natin tatalakayin yan sa ganitong punto dahil konti nga yung bakuna natin.
Based on the evaluation of the Food and Drug Administration on the Sinovac vaccine, it has a 65 to 91% efficacy rate for ages 18 to 59 years old, while a 50% efficacy rate among health workers and senior citizens. Meanwhile, vaccine experts continue to encourage the elderly to get vaccinated.
They're even more vulnerable to the severe kind of COVID disease. So we encourage our elderlies and our seniors to be vaccinated with whatever is available.
So the inactivated vaccine may still stimulate your immune system to produce an immune response. So rather than not being vaccinated and not being protected, I would rather that they be, most especially the seniors, be vaccinated since it already had been approved for that age group.
The experts hope that the public's confidence on vaccine will increase and more people will be vaccinated. Janice Enhente, UNTV, News and Rescue. We serve the people, we give glory to God.
Patients who have recovered from the coronavirus disease or COVID-19 should still get vaccinated to get immunity according to medical experts. Ray Pelayo will tell us why.
Antibodies produced after being infected by COVID-19 is not sufficient in giving a person protection to be infected again with the virus, according to medical experts. Dr. Ronjin Solante, member of the government's vaccine expert panel, said that COVID-19 survivors may have 3 to 4 months of protection, but a patient may still be reinfected with the virus because the level of protection given by the antibodies will eventually decrease.
That's the reason why even if you have recovered and you have that antibody, you need a vaccine. Because the vaccine, the antibody produced by the vaccine is more or less will maintain a level na mas higher doon sa antibody mo na nakuha nung naka-recover ka.
The Department of Health and other experts shares the same sentiment.
Kailangan ka pa rin magpabakuna para nabuboost mo pa rin itong antibody production mo so that you can have a better immunity against this disease.
It's very important because also we don't know how long the antibodies will last, and we don't know the antibodies resulting from an infection versus that being from immunization. So I would certainly recommend.
I think it's basically going to boost your immune response even more. I don't know that people have checked antibodies specifically, but I know a number of patients who've had active COVID and they've gone on and gotten their vaccines, even 2 doses. So it's definitely recommended here to do that.
Experts say that getting vaccinated will not only give a person protection against COVID-19 but also for his family. Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
Vaccination process was made apace at San Juan City through a system developed by the Department of Information and Communications Technology, or the ICT. The system is also expected to be applied around the country following the city's pilot testing. Marvin Calas reports why.
A faster and much convenient queues for vaccinees were observed at San Juan City today, from 20 minutes down to only 10 minutes of waiting from registration up to the post-vaccination process. This is due to the digitized and systematic process of vaccination using the Vaccine Information Management System Immunization Registry, or VIMS-IR, of the DICT.
Ito po ay isang vaccine management system kung saan all the way from vaccine registration, information ng pasyente, consent ng pasyente, actual vaccination, post-vaccination hanggang sa reporting namin sa DOH, ito po ay digital na.
It also provides relief to healthcare workers in collating necessary information that leads them to work overtime until 10 p.m. for the sake of reporting.
Maganda dito sa sistemang to, kahit yung mga LGU na mayroong sariling sistema, ay pwedeng mag-integrate dito sa sistemang to. No? So open system siya.
The system is also expected to be adopted around the country, considering the cities under the government's priority list such as Cagayan and Zambales.
May mapping system tayo. Siyempre, uunahin natin yung pinakamalayo, pinakamahirap, pinakamaliit. Yun talaga ang nangangailangan. Ang priority system natin is not going to be driven by partisan political motives.
Senior citizens were also delighted following the swifter vaccination process.
Maganda po ang proseso dito. Napaka-organized po. Mahusay ang proseso na ginawa ni Mayor Zamora. Wala problema sa bilis. At the same time, thorough naman sila. Kanina, medyo mataas ang blood pressure ko. Hindi talaga nila ako binitawan hanggang sa nakita nila bumaba.
Marvin Calas, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippines recorded 8,571 more COVID-19 infections today, bringing the total caseload to 884,783. In its 4 p.m. bulletin, the DOH said the latest tally pushed the country's total active cases to 165,534. The agency, however, noted that the tally does not include data from 9 laboratories that failed to submit their reports on time. The DOH also reported that total recoveries rose to 703,963 after 400 more patients recuperated from the viral disease. The death toll climbed to 15,286 with 137 new fatalities. Medical groups are now planning to build floating hospitals as the country's health facilities continues to be burdened by the rising COVID-19 cases. Nel Maribohok will tell us why.
Most of the hospitals in Metro Manila are overwhelmed and are operating at full capacity amid the spike in COVID-19 cases in the country. With this, the Philippine Medical Association, by their initiative, plans to convert passenger ships to COVID-19 hospitals. According to Dr. Jose Grano, president of the Private Hospitals Association of the Philippines, it will surely help decongest the hospitals.
Nung last mag-meeting kami, ay parang gano'n ang balak nila ay magmo-monitor lang ng mga pasyente. Pero walang masyadong treatment. Ang pinaka-treatment lang dyan, halimbawa kung nilalagnat, may ubo, yung symptomatic treatment lang.
The said hospital ships can dock at various ports in Metro Manila and nearby provinces with the partnership with a specific land-based hospital. The ships will be manned by members of the organization and other healthcare groups.
Yung mga medical workers dyan, halimbawa, may isang doktor at may dalawang nurses na, hindi talaga sila magmamanage masyado.
The challenges here now, he said, is how to transfer the needed medical equipment and also the additional healthcare workers. Shipping companies has yet to comment on the matter. According to Department of Transportation, they are currently focusing in government's isolation facilities in Eva Macapagal Terminal in North Harbor and Port of Kapinpin in Bataan. Nel Maribohok, UNTV News and Rescue, we serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. President Rodrigo Duterte directed the Department of the Interior and Local Government, or DILG, to conduct an investigation on the complaints and reported irregularities on the distribution of cash aid in NCR Plus areas. The president made the statement last night when he met with some government officials. DILG Undersecretary Bernardo Flores reported to the president that they have not received complaints on the cash aid distribution in the Greater Manila area, but the chief executive said he has seen media reports saying otherwise. Around 23 million beneficiaries from low-income households in NCR Plus areas are expected to benefit from the government's assistance following the 2-week enhanced community quarantine.
Maraming nagreklamo na so ask your field officers to try to make the rounds and investigate if these allegations are true.
The Department of Education, or DepEd, has rejected calls from different groups for a nationwide academic break. Dante Amento tells us why.
8-year-old Arian Gregory is now a grade 3 student, but despite of her age, lack of gadgets for online learning, she believes education is important to attain a bright future.
Mahalaga po sa akin yung edukasyon para matulungan ko po yung mga magulang ko.
The Department of Education or DepEd, on the other hand, stands that the delivery of education must continue amid calls of student groups for an academic break.
Yung po mga walang gadgets, hindi rin po siya dahilan para itigil na kasi nga po alam naman natin iba-iba yung paraan ng pagpapatuto sa mga bata. Pwede pa rin po yung printed self-learning modules na gamitin.
DepEd recently said students in the Philippines are already left behind by other countries in terms of education. Education Undersecretary Diosdado San Antonio says they have been implementing academic ease to lessen the burden of teachers and students.
Ang sinasabi rin po natin sa mga kasamang guro ay huwag masyadong mahigpit sa mga deadlines kasi nga po nauunawaan natin na masyadong mapanghamon ang mga ginagawa.
Senator Sherwin Gatchalian also opposed calls for a nationwide academic break. The lawmaker warned that another disruption in the education would result to some students dropping out and learning loss, among others. The DepEd extended the current school year in public schools on July 10, 2021 as learning gaps were seen and have to be addressed to meet the required essential learning competencies. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Last March, Vaccine Czar Secretary Carlito Galvez Jr. stated that Serum Institute of India will help the Philippines to locally produce COVID-19 vaccines. This is why experts from the Department of Science and Technology and other agencies are already planning on how to make it possible. Aiko Miguel has the story.
The Department of Science and Technology Task Group on Vaccine Evaluation is already looking into possibilities on how to locally produce COVID-19 vaccines. According to DOST Vaccine Expert Panel Head Dr. Nina Gloriani, they are checking into the feasibility, capacity, and the country's capability to manufacture vaccines.
Pinag-uusapan na hindi tayo pwedeng nasa mercy ng mga suppliers na pag ayaw nila tayong bigyan o di wala tayo. So we have to build capacity for the Philippines. Na sana noong pero never mind, we have to learn from all of this. May timeline sila. Yung mga iba nakita na nila na hindi lang for COVID but for other vaccines that could be produced here.
Because of the global demand on COVID-19 vaccines, experts are also looking into the possibility of administering vaccines by mixing of vaccine brands.
That is a very parang practical or realistic scenario that we may be looking at with these so many vaccines that we have now. But remember, they are different platforms. They will come up with a recommendation soon. I think it's possible, but there has to be guidelines.
According to Food and Drug Administration, the country is open for help from other countries like Serum Institute of India to locally develop and manufacture COVID-19 vaccines. But currently, the country has no enough resources for the vaccine development.
At this time, we don't. No? We used to have a vaccine manufacturing program, no? Pero matagal na panahon na yon. And at this time, we don't. And I think during this pandemic, it has been, I think this is one of the realizations that all vaccines kasi talaga in the Philippines are imported. No? At wala tayong self-sufficiency when it comes to vaccines.
Experts stay hopeful that vaccination has a large part to protect Filipinos against COVID-19 infection and deaths. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Former President Joseph Erap Estrada has now tested negative for COVID-19. His son, former Senator Jinggoy Estrada, said his father is still on high-flow oxygen support but at a much reduced rate. His father has also been allowed to resume a soft diet, he added. He also described Erap as oriented, conversing normally, and appears to be in good spirits. The former president tested positive for COVID-19 in late March.
The Department of Transportation allowed the resumption of operation of additional public utility jeepney units and routes starting today. But some jeepney drivers worry about it. Let's find out why from Asher Karapan Jr. live. Asher.
Some public utility jeepney drivers fear that their already low daily revenue may become much lower as competition gets higher with the addition of 2,000 jeepney units and 62 routes in Metro Manila. The drivers seek for help from the government and private sectors, explaining they recently get only about 150 to 200 peso daily earnings. They relate their low revenue to the very minimal passengers utilizing jeepneys, while also accounting the limited passenger capacity, all due to the community quarantine restrictions being implemented due to the pandemic. Let's hear it from the president of one of the Jeepney Operators Drivers Association in Quezon City.
Talaga naghihirap na yung mga driver at operator. Kasi sobra-sobra na rin ang dami namin, nagdagdag pa ng mga bagong jeep. Nahihirapan na rin kami ngayon. Dati ang biyahe namin, nakaka-7, 8 biyahe kami. Ngayon, tigta-3 biyahe na lang kami. Ang mabigat pa doon, syempre, yung social distancing. 5-5 na lang ang naisasakay namin. Kaya yung kada ikot namin, halos pang krudo lang ang nakukuha namin eh.
The Department of Transportation, on the other hand, continues to encourage drivers of both traditional and modern public utility jeepneys to avail of the service contracting program of the government. But Transport Group Pasang Mazda National President Obet Martin said he was disappointed to find out that several traditional jeepney drivers refused to participate in the said program.
Marami na akong sinabihan, subalit parang binabaliwal nila at para daw hindi totoo. Well, sabi ko, subukan niyo muna. Huwag kayo magsalita ng hindi niyo pa nasusubukan. Kasi ang nakalagay dyan ay tumakbo ka lang ng 25 kilometers, you have your 800 pesos.
And that's the latest for the story. Back to you, Diego.
Thank you, Asher Kadapan Jr., reporting live. The prolonged uncertainties brought by the pandemic have been causing anxiety and fears to many Filipinos. This is why a psychologist highlights the importance of keeping in touch with your family and friends in this extraordinary time. Arlene Delgado will tell us why.
It has been a year since the country began fighting the COVID-19 pandemic. Many Filipinos have been locked up in their houses due to quarantine restrictions. And because many have yet to see their family and friends, some people have no other way but to vent their worries and emotions out on social media. According to psychologist Dr. Camille Garcia, it is important to stay connected, noting that a simple message can go a long way.
Huwag niyo sasabihin na wag ko na lang silang gambalain kasi baka makadagdag pa ako sa problema na nararanasan na iba. No, at this point, napakahalaga at napaka-importante na makipag-usap ka because one of the easiest way na para sabihin natin maibsan yung anxiety and depression is to have somebody to communicate with. So, talk therapy nga.
For Dr. Garcia, it is essential to listen with sincerity and have empathy. It is also important to fully understand one's situation and not to invalidate other people's feelings.
Just greet this person, good morning. Okay ka ba? Kahit alam kong hindi ka okay, nandito ako para tulungan ka. The mere fact na meron kang ginawa, malay mo, yun yung makakapag-enlighten sa kanya na, meron pa rin nakakaunawa sa akin, and you're able to save a life with just 2 sentences every day.
Dr. Garcia reminds everyone not to hesitate to reach out to someone and to ask for help. It is also best if we can handle stress positively. And above all, pray unceasingly and grow spiritually.
Sana makita ng mga tao na hindi lang po basta pagdarasal ang kinakailangan, kundi yung higit na panalangin at makita nyo na mas mataas yung pamamaraan ng pananampalataya sa Diyos. Kasi if you have that faith in God, everything will be put into proper places.
Arlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
The Armed Forces of the Philippines has deployed more sea assets to different areas in the West Philippine Sea amid the lingering presence of Chinese vessels at Julian Felipe Reef in the West Philippine Sea. Leah Ilagan reports.
The Philippines will continue to resolve the issue on the West Philippine Sea in a diplomatic way. Armed Forces of the Philippines Chief of Staff General Cirilito Subihana said the Western Command intensified its maritime operations, which includes the deployment of government sea assets to various areas in the contested waters to conduct sovereignty patrols and other operations.
Ginagawa natin yung ating sovereignty patrol at mayroon din tayong resupply, reprovisioning of our deployed forces at the different shoals and reefs.
Subihana said that their next action will depend on the situation they will be find in the disputed island.
We do not want to wage war against anybody. Policy of our president that we should be friend to everyone and enemy to no one. China is a superpower and we are a third world country. Sa labanan sa dagat, hindi natin matitiyak na tayo ang manalo. Pero kung sa lupa yung labanan gagawin, ako'y nakakasigurado na mayroon tayong advantage.
For Philippine Navy vessels, namely BRP Dagupan City, BRP Apolinario Mabini, BRP Magat Salamat, and BRP Miguel Malvar, has been deployed by the Armed Forces of the Philippines. The said ships are also providing support and assistance to the Philippine Coast Guard, which has deployed BRP Cabra, and to the Bureau of Fisheries and Aquatic Resources, which sent 2 more ships in the area. The Area Task Force west of National Task Force for West Philippine Sea also urged all Filipinos to know and understand their role and to take their part in the nation's stake in the West Philippine Sea, so that through the whole of nation efforts, the national interest and security will be safeguarded for the present and future generation of the Filipino people. Leia Ilagan, UNTV News and Rescue. We serve the people, we give glory to God.
Manila Water has fully restored its service to areas affected by the EDSA water leak incident. But the water distributor said that the service restoration may take a while in some areas. Asher Kadapan Jr. explains why.
The Manila Water Company explains that the unusual high demand upon energization of the water line after a service interruption may take time for pressure to build up going to the farthest and most elevated portions of the affected areas. The water distributor further explains that such occurrence is normal in restoring the service, especially after a long period of interruption where those nearer the source of their main water line builds pressure easily and are the first to have normal water supply. This explains why some customers experienced no water service until around lunch hour today, despite the early completion of the repair of the damaged pipeline in EDSA Pioneer Street in Mandaluyong City and the reopening of the pumping station for the restoration of the water service, which happened at about 6 this morning.
Kasi biglaan, di ba, nasira agad yung pump. Walang abiso sa amin. Hapon na madaling araw, 1:00. Hapon. Hanggang ngayon, wala. Tapos nung hapon na dumating yung barangay, yung bumbero, tsaka lang kami na bigyan ng supply. Konti lang niluto namin.
The Manila Water, however, assured that the water service has already been fully restored in all affected areas at about 2 p.m. today. The company advises their consumers to allow a few minutes for the water to be flushed before using their taps. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Media workers will be included in the recommendation for the A4 priority list in the vaccination program. This was clarified by National Task Force Against COVID-19 Deputy Implementer and Testing Czar Vince Dizon following the exclusion of media workers in the recommended list released by the National Economic Development Authority or NEDA. According to Dizon, NEDA Acting Secretary Carl Chua told him that the recommendation list will be revised to include media personnel.
Tingin ko nakaligtaan lang ng NEDA. Pero sa pagkausap namin ni Sec Carl Chua kahapon, i-revise nila ang list na kasama ang media.
The Department of Health confirmed that NEDA already included media workers in the recommendation but clarified that the final list has yet to be approved by the Interagency Task Force for the Management of Emerging Diseases, or IATF-EID. Earlier, Senator Joel Villanueva urged the IATF to include workers in the media industry in the A4 priority group as they are considered information frontliners. The A4 priority group, composed of economic frontliners and essential workers, is next in line for the COVID-19 vaccination, following healthcare workers, senior citizens, and persons with comorbidity.
President Rodrigo Duterte and Russian President Vladimir Putin talked via teleconference this afternoon for 30 minutes. The two leaders reaffirmed their commitment to further enhance cooperation and vowed unity in the fight against COVID-19. Both presidents discussed the global and regional vaccine landscapes, noting that vaccines such as Russia's Sputnik V must be mobilized to as many countries as possible. Around 20,000 of Russian-made Sputnik V vaccines will be used in a vaccination dry run in the Philippines. 500,000 doses of these vaccines are expected to arrive this month. India overtook Brazil to become the country with the second highest number of coronavirus infections in the world. Marvin Delfin will give us the details live. Go ahead, Marvi.
Kath, India has reported a record tally of 168,912 COVID-19 infections on Monday, making it the world's highest, while worries continue to grow over a further spike as hundreds of thousands gather for a ritual bath in the Ganges River. Monday's new cases carry the country past Brazil for an overall count of 13.53 million, placing it second after the United States, which has 31.2 million. The death toll has also been rising steadily and now stands at 170,719, with 904 new deaths yesterday, which is over twice as many as the USA in the same time period. India is now experiencing its worst surge of the pandemic, with a 7-day rolling average of more than 130,000 cases per day, despite its health ministry saying it had become the fastest country in the world to administer more than 100 million doses of COVID-19 vaccines, taking only 85 days. India's drive to vaccinate 300 million people by the end of July needs a boost amid issues of low vaccine stocks in some states due to stressed production capacity. Health Minister Harsh Vardhan has blamed India's second wave on people's relaxed attitudes and lack of commitment towards wearing masks and practicing social distancing. Other health authorities also noted that participation in a number of religious festivals and political rallies have hurt the nation's response to the outbreak. In the next coming days, as many as 5 million more pilgrims are expected to head to the city of Haridwar for the Kumbh Mela festival, which was delayed this year due to the pandemic. Back to you, Kath.
All right, Marvi, thank you for that live report. A clash between protesters and the police continued for the second night in a row after the killing of a black man in Minneapolis, which was described as an accidental discharge. Therese Longbowen will give us the details live. Therese?
Kath, attention sparked on Sunday upon hearing the news of a 20-year-old man named Dante Wright being killed in Minnesota when he struggled to get back into his car after being pulled over by the police for having expired license plates and violation of a Minnesota law prohibiting the hanging of air fresheners and other items from their rear view mirrors. The released body cam footage of that incident was shown by Brooklyn Center Police Chief Tim Gannon on Monday, where an officer can be heard shouting, "I'll tase you," and taser, but instead shot Mr. Wright with a single bullet, from which Chief Gannon described as an accidental discharge, as it was his belief that the officer meant to deploy their taser. Officer Kim Potter, the officer who has been working with Brooklyn Center Police Department for 26 years and the one who shot Mr. Wright, has been placed on administrative leave. Protests continued on its second night outside the Brooklyn Center Police Station despite the dusk to dawn curfew being implemented. Police fired gas canisters and flashbang grenades 19 minutes after the curfew deadline on Monday. Tensions are high as the trial of Derek Chauvin, the ex-officer accused of killing George Floyd, has been ongoing for 2 weeks now. Kath?
Thank you, Charisse Longbowen, reporting live from Thailand.
An observational study suggests that sunnier places are associated with fewer COVID-19 deaths. Dale De Castro reports why.
A study conducted by the University of Edinburgh researchers reveal that there is a correlation between sunlight exposure and COVID-19 deaths. Increased sunlight exposure decreases the risk of mortality related to COVID-19. Not to be associated with vitamin D, sunlight enhances the production of more nitric acid that is excreted by the skin, which is said by the researchers to eliminate the multiplication of the virus SARS coronavirus 2. The analysis of the results originating from Italy and England showcased that those who live in areas exposed to higher levels of UVA rays that amount to 95% of the UV light of the sun, had a decreased potential of facing death due to COVID-19. Dr. Richard Weller of the University of Edinburgh welcomes the idea that sunlight may be a possible intervention in reducing the rate of COVID-19 mortalities. The researchers provide a possible explanation by connecting previous studies where sunlight was associated to decreased blood pressure, resulting in the decrease in cardiac arrest potential, a factor to deaths related to COVID-19. The research paper has been released by the British Journal of Dermatology, and though it is not possible to establish the cause and effect of the study due to the observational nature, however, it may lead to interventions that could be tested as potential treatments. Dale De Castro, UNTV News and Rescue. We serve the people, we gave glory to God.
Scientists have found individuals who have poor oral health are prone to developing neurodegenerative disorders like dementia. Iya De Vera reports why.
According to a new study, scientists underwent sampling of cerebrospinal fluid and bacterial gum swabbing of the volunteers in order to find the relation between oral health and the mental illness. The age group included 48 healthy volunteers, all aged over 65 years old. The reason for this being the people of this age are at high risk of both dementia and gum disease, with 70% of the elderly population suffering from oral health. Through this methodology, high levels of the protein amyloid beta, which is commonly associated with Alzheimer's disease, was found amongst individuals with poor oral hygiene. These protein cells are said to have the tendency of bundling together within the brain, forming plaques around nerve cells, resulting in hindrance function of the brain and cognitive impairment. A leading theory suggests that diseases capable of promoting inflammation like periodontitis or gum disease prevents the human body of removing amyloid plaques from the brain. Although a link has been made between the underlying causes of the illness and the protein, further studies have to be made as it is only partly comprehended. There are many causes to an infection like a gum disease, such as stress, food consumption, age, smoking, and poor oral hygiene. The best way to prevent this is to keep in moderation of what food to consume. Establishing good cleaning routines like brushing twice a day for 2 minutes with a good toothpaste, flossing, and consistent appointments to the dentist. Iya De Vera, UNTV News and Rescue. We serve the people, we give glory to God.
The concept of the MCGI Free Store inspired a barangay in San Juan City establish its own free store to help its residents amid the pandemic. JP Nunez will give us the details live. Yes, JP.
Yes, Harleen, the week-long activity of the Members Church of God International, or MCGI,
which gives millions of people worldwide assistance to their basic needs amidst this pandemic, inspires Barangay Ermitaño in San Juan City to build a free store. They have opened their site on a daycare center to cater the needs of their constituents whose living are severely affected by the pandemic. The free store targets to help 60 indigent families.
First ever yung tinayo ng MCGI na free store na worldwide na nagbigay ng mga libreng paninda. So, kaya pala ng isang organisasyon, ng isang kongregasyon na makapagbigay ng ganun. Wala namang ayuda galing sa gobyerno yun, di ba? Bakit ang gobyerno hindi kayang gawin? Na ang gobyerno naman may pondo para sa ganung bagay. So, sinuggest yung Kap, bakit hindi natin gawin? May pondo naman. Magtayo tayo ng free store dito sa atin.
Arlene, the Barangay Council allotted a 100,000 peso fund for the said project, which estimatedly can support the free store up to 6 months. But for them to continue the project, they are open for donations to provide supplies for free store in order to continue until there are individuals who are in need. Even Mayor Francis Zamora personally witnessed its launching yesterday and promised to donate other basic needs as he sees the good purpose of the free store.
Sa ngayon, nakakatuwa naman, meron na kaming nag-donor, konti. Si Mayor nag-pledge na magbibigay siya ng ilang kabang bigas. Si Vice Mayor, ganun din. Sa akin, may nag-message na galing sa Canada. Sige ka, magpapadala ako dyan, pandagdag. Alam mo yung mga ganun, nakakatuwang, ang sarap ng pakiramdam.
Every qualified recipient will receive a cash voucher equivalent to 500 points, which they can use to avail the free items. The Ermitaño Free Store is open every Monday, Wednesday, and Friday. The aspiring recipients should coordinate with the barangay officials in order to get the coupon and be assisted for the process of the free store. That is my report. Back to you, Harleen.
Thank you, JP Nunez, reporting live. And those are the reasons behind the news, April 13, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am Kat Dumaraos, reporting live from Bangkok, Thailand, sitting in for William Theo. We serve the people, we give glory to God.